Now that we know what cannabis is, let's talk about what the different cannabinoids actually do in our body. Keep in mind that detailed research on cannabis is new and still limited, so always err on the side of caution with cannabis products. THC binds easily to the brain's CB1 receptors because THC mimics the body's internal neurotransmitter, anandamide. When THC works with CB1 receptors in the hippocampus, learning and memory are affected, whereas stimulation in the amygdala has been linked to reduced anxiety, increased appetite, the sensation of novelty, awe, and forgetting negative experiences. In the basal ganglia, THC reduces spontaneous motor activity, which is why it can be dangerous to drive or operate machinery. In the frontal cortex, high concentrations of stimulated CB1 receptors can decrease worry about risks and impact executive functioning, especially in brains that are still developing. The brain continues to develop through the mid-20s. Executive functioning includes planning, the ability to focus attention, remember instructions, and juggle multiple tasks. In the short term, cannabis use has been shown to have a negative impact on learning, memory, and attention, but it is less clear if these changes last long-term if cannabis use stops. In a literature review conducted by the National Academy of Sciences, the authors found evidence that cannabis users may be engaging different neural networks to achieve a similar outcome as a non-cannabis user. Cannabis affects everyone differently depending on body chemistry, genetics, and intake method. Some people may experience uncomfortable side effects, such as anxiety, elevated heart rate, drowsiness, thirst, and vomiting, especially if they have large amounts. There is a rare condition called cannabinoid hyperemesis syndrome among long-term users which can cause nausea and vomiting, and is relieved by taking hot showers and stopping cannabis use. Cannabis use should also be ceased if the individual has a severe allergic reaction, such as hives or difficulty breathing. If someone is having an adverse reaction from overconsumption, they can lie down, relax, or eat something. Peppercorns, which contain an anti-cannabinoid compound called beta-caryophyllene, may help. Overconsumption happens most often with edibles. With smoking or vaporizing, the cannabinoids enter directly into the lungs, which then travel through blood vessels to the brain, so the effects occur almost instantly, or as long as 5 minutes. Whereas with an edible, the body has to not only digest, but then process the cannabis in the liver before it enters the bloodstream, so it can take several hours to feel an effect. This is because the chemistry of THC is changed in the liver by removing CO2. The chemistry evolves into a compound known as 11-hydroxy-THC, which feels 4 times stronger and can last up to 6 to 8 hours. Be aware that smoking cannabis still has some of the same carcinogens as tobacco and can lead to bronchitis and other lung conditions with excessive use. Also, anyone pregnant or considering getting pregnant should consult with their doctor since THC can be passed to the baby. Cannabis has a long history of medical use, dating back more than 2 millennia. Studies and personal testimony have indicated that components of cannabis could have extraordinary medical potential. In fact, the cannabis industry in California all started because of patients and caregivers building an infrastructure and legal pathway. Cannabis has been used to address cancer, HIV/AIDS, multiple sclerosis, glaucoma, seizures and epilepsy, pain, and many other conditions. Some research identified by the National Academy of Science suggests that cannabinoids and the endocannabinoid system may play a role in the cancer growth regulation process, and that cannabinoids have an anti-tumor effect. Another potential application of cannabis is to treat sleep disorders, decreasing the amount of time to fall asleep in low doses. There needs to be continued research to discover its full potential, starting with more research for seizures and post-traumatic stress disorder. While the benefits and health risks of cannabis are still not fully understood, it is clear the potential risks are greater for teenagers and other young people, which is why recreational cannabis is for adults 21 and over.